Hi, it's Dr. Arif Rajpura here, Director of Public Health for Blackpool Council. Just to give you an update on where we are with the coronavirus pandemic. I'm pleased to say that cases have continued to fall, albeit slowly, but they're still heading in the right direction. And you will have seen from Dr. Jim Gardner, Medical Director at the Trust, that the hospital is in a much better position as well. So generally, things are heading in the right direction, and I'm pleased with the progress we've made. Thank you again to everyone who's been following the rules, complying with the hands, face and space, staying indoors as much as possible whilst we're in this lockdown period. Please continue to follow those rules, because that really helps drive the infection rates down. The other pleasing thing for me has been the progress on vaccinations, and we've delivered 52,000 first doses of the vaccine across the Fylde coast, 39,000 of which have been delivered in Blackpool. So really pleasing. And what, from the statistics I'm seeing, over 95% of the over 80s have been done, over 90% of the over 75s have been done, and more than three quarters of the over 70s have been done. I think we're well on track with getting those groups done by the 15th of Feb, which is the target. So I'm really thrilled and pleased with the progress we've made, and thank you to everyone that's responded to the letter and come down and had their vaccination when they've been asked to come down. Important things to remember when you come to our mass vaccination site at the Winter Gardens: there's 1 hour free parking at the East Topping Street car park. Please come alone unless you need essential support from a carer or a relative. Our friendly marshals are all on hand to help and support everyone attending. So if you do need any help, they're there and they'll be visible. So please ask them for any support you may need. Make sure you arrive just on time. So I'd say, try not to be too early or late. This really helps the smooth running of the particular centre. We urge people to book their COVID vaccine appointment once they've been invited by the letter. So just follow the instructions on the letter, get your appointment booked. But yeah, really pleasing. And hopefully from next week onwards, we'll be rolling out the vaccination programme to other groups. So our target is that by the end of April, we want everyone over the age of 50 and those that are clinically vulnerable vaccinated and done by the end of April. The other thing I wanted to mention is testing, and we have two different types of testing. So we've got symptom-free testing, asymptomatic testing as it's called, going on at the moment. So this is for people that have to leave their home to go to work. So people that have those jobs that require them to be outside of the home. For instance, if you work in a supermarket or a shop, or you've got another front-facing job, we've got testing available. So this is symptom-free testing available at specific sites across Blackpool, and you'll find the details of those sites at the end of this video on the council link. This is symptom-free testing, so this is not for people who are symptomatic. If you are symptomatic, then you need to follow the normal routes of going on the NHS website or ringing 119 and getting a test done that way. So slightly different to if you've got symptoms of coronavirus as opposed to asymptomatic testing. And want to reiterate that the asymptomatic testing is particularly for people who have to leave the home to go out to work. So it's for that group of individuals. But we've got plenty of testing capacity for asymptomatic testing and also for symptomatic testing. And the symptomatic testing, as I've said previously, we've got the site at the end of Yeadham Way on the car park there, and we also on certain days have a mobile testing unit that turns up on the Devonshire Road car park site. Thank you for listening once again, and thank you for doing everything you've done so far. Please continue to follow the rules. We've got a few more weeks of this to go. We need to get to spring and the end of this lockdown and then see where we are with the rates. We'll see what the government thinking is on lifting of restrictions. I suspect what will happen first will be that the schools will go back in March, whether that's all the schools or just primary schools in the first instance, that's still up for discussion. So we'll see what government's plans are at that point. But the schools will probably be the first things to open, and then we'll have a slow releasing of the restrictions. So it won't be a wholesale restriction. But in the meantime, what we need to do is keep driving those rates down. So currently the rates are at just over 200 cases per 100,000, which have come down, but I want to drive those rates further down. So we need to get those rates as low as possible as we go into spring, so that we can be in a good position to start to lift some of the restrictions. And of course, the restrictions help, but also the vaccination program will start to kick in from, in my book, it'll start to work into the figures from now onwards. So we should start to see the benefits of the vaccination program from now onwards. So thank you again for listening, and I'll see you on the next one.